Hey, welcome to the Ivy League, where we celebrate some of healthcare's finest, and today's no exception. We have Emmy. She actually graduated with me about a year ago in December from nursing school, so I really wanted to have you on this podcast because we have something in common.
Thank you so much. I'm excited to be here.
Yes, thank you.
Yeah.
Bright-eyed and bushy tail. I like
yes.
it. So we actually switched careers.
Mm-hmm.
So we pivoted did a 180 for me was finance, and I want to talk about what you pivoted from and some of the struggles or hurdles that you had to overcome, because nursing school is not easy.
Absolutely.
So I want to get your perspective on that, because there are people out there who are probably thinking about switching, but do not know what it entails. Mm-hmm. So first of all, tell us what you're currently doing and how's it going?
Sure. So I graduated with Jazz from Emory Nursing School, and I'm currently in a residency program in the OR.
Okay. So we're both in the OR.
Yes.
Oh, it's surgery. So you like it?
I do like it. It's fast and furious, but it's every day is different and you learn something new every day.
So what service lines have you done mostly?
Mostly, pretty much I do everything except CV, cardiovascular.
Okay.
So I'm in neuro, ortho, plastics, ENT, pretty much the whole gambit.
Same.
Yeah.
Interesting to have that conversation about that later.
Yeah.
Okay. So the main topic is switching careers. Mm-hmm. So what were you doing before this?
Directly before going back to nursing or going to nursing school, I was an executive assistant for a large commercial real estate development company.
Okay.
And prior to that, I had worked with the same company in HR for 6 years as like a human resources and payroll assistant. And I've also worked for long-term disability insurance, and I worked for the government as part of the Department of Labor. So kind of done a few different things, but all of them were kind of service and customer service oriented or socially oriented. So this was going into the medical field was like the first time that it was kind of hands-on.
Interesting. Why the medical field? You know, it seemed like you kind of had the insurance part down, the HR part down. So why nursing?
So in 2020, I decided to take a wilderness first responder class at the Nantahala Outdoor Center in North Carolina. And I was really just blown away by the experience. I do a lot of festivals. I do a lot of camping. Wow. And so we'd had some medical, things happen in our camps before, and I thought it would be a great value to have that knowledge. Right. So doing this training, it was a week-long training. It teaches you how to treat injuries and illnesses in the backcountry when you're not at the hospital. Right. And I was like, wow, I really like this. Right. I liked my job as an executive assistant, but I was like, I'm going to be doing the same thing for 20 years if I stay in this. So that's when I decided, I was like, maybe I want to pursue something within the medical field. It kind of ignited it then.
Okay. So not a surgeon, not a doctor.
Yeah.
But nursing.
Yeah. Well, my dad's a physician, and I'd been working for 15 years. So going back to school was like, okay, well, what's step number one? Right. I was like, I know I can do nursing. Let's try that and see where it goes. So yeah.
I like that. So your father was a physician.
Yes.
So what was his opinion when you told him that?
He loved it. He thought it was great. He works as a radiologist, was kind of more hands-off doctor, but we always grew up, he talked about his journeys in medical school, different experiences that he's had. Right. We always talked about maybe cases that he had seen like during the day. Mm-hmm. So it was really, he knew what it was about, and he was very supportive.
So you were always around it.
Yeah, kind of, the knowledge. He talked about his job a lot. So I was like, okay, this is something that's approachable for me, I think.
I think so. So what made you choose, there's a lot of nursing programs, right? So what made you choose Emory or, the number one nursing school in the country?
So, but
what made you choose that?
I think, I had been in Atlanta for 9 or 10 years when I went to Emory. Emory just is, of course, it's a great name, a great school, great facility. The company that I worked for, the vice president that I worked for, he had a master's degree from Emory. There was another executive that had a degree from Emory. So I just seen really good things come out of it. And I was like, let's explore it. I did do my prerequisites at Georgia State. So it's like, got a more experience in Atlanta schools. But yeah, ultimately I was like, Emory, that's the only one I applied for, was the Emory nursing school. Yeah.
And that's the only one I applied for, but I didn't mean to.
Okay.
Like, it just so happened I was like, I want to go to anywhere. I just wanted a nursing degree. It just so happens that Emory was kind of fast about their decisions.
Yes.
And other schools, gave me a decision after Emory had already gave me a decision. I was like, Anyway, so
Yeah.
switching careers.
Uh-huh.
So you're in the first semester. At any point, did you second guess your decision to switch?
Absolutely.
Okay.
I think if you're in nursing school and you don't ask yourself that question, it's
Okay,
like
that's fair. I just want to make sure you
hard.
had that epiphany at some point.
Yeah, like you kind of get into the program and you're like, what am I doing? Do I really want this? Like, it's so overwhelming. It's so hard, but physically and mentally, like you second guess yourself going into everything.
Yeah.
I think it's like every big project that I had bought a house, a historic area, and renovated it 8 years ago, and that was another big project. I felt like,
right.
It felt paralleled to this trajectory that I was on with nursing school. Because at first you're like, wow, this is exciting. I have a house, and then you're like, or I'm going to school, and then you're like, what am I doing? What do I do with this? And then something goes wrong, and you're like, blood, sweat, and tears. You come back. I think it's always important to come back to your why.
Yes.
That's definitely a big question of what you're getting into. Why am I getting into this? And exploring that deeply. So I think, of course, I think that's a healthy question to ask.
It is.
Whether it's like pulling your hair out, what am I doing?
Right.
But I think it's always good to go back and reflect and kind of go back to this initial why of your doing. So I think, of course, with any hard thing that's blood, sweat, and tears and passionate is going to be a challenge, and you're going to be asking yourself that question. So absolutely.
So because we, like you said, we've all had that moment, right?
And
the why is important.
Yes.
And so do you remember the very first test we had in nursing school?
What probably is a pharmacology one?
That was the second test.
Okay, that was the second
The first one I believe was patho.
Okay.
It was one of them. But do you remember when you took the first test? I'm trying to gauge
maybe
when
I blocked it out.
Maybe you blocked it out. I'm trying to gauge when you had that epiphany as far as, well, I'm second guessing myself. Because I didn't second guess myself on the first test. Like my first test, believe it or not, was my lowest grade in nursing school.
Oh, wow.
After that, I know how to study for it now.
Yes.
Because I studied so hard for the first test.
Yeah.
I got like a 74.
Okay.
And I was like, okay, this is how you want to play.
Yeah, yeah.
And I think my average test grade was like a 90 or 89 point something going forward.
Yeah.
Because I was like, okay, this is not, I have the why.
Yes.
Because there is no plan B.
Yeah.
This is my plan A. Plan B is to find another way to make plan A work.
Yes.
So that's where I was coming from. So in the moments when you second guess yourself, how did you get back on track?
You just kind of have to take it one day at a time. What's the phrase where you eat an elephant one bite at a time? And it's like, what can I do? Coming back to the present moment. It's
right.
Like, what can I do now? What can I work with? What is achievable for me in this moment? Kind of, if I think too far ahead or if I think too far behind, then you really get caught up in that. And you can say, what if I haven't studied enough? What if it's a day before the test, you have 12 hours to the test. What if I haven't studied enough? And you get caught up in that.
And you're studying right before the test, like you're going to really retain it, right? It's like,
or come back to it and say, okay, well, what can I do? I can study for the next hour, 2 hours. I can do that. So that's what I'm going to do right now. And that's all I can do. And kind of just say, what is the best that I can do in this moment, rather than keep coming back to yourself and saying, I didn't do enough, or this is something, you can concentrate on that, or you can say, this is all I can do in this moment, and that's the best I can do. And then even if you finish it, however you did, you just say, I know that I did the best that I could.
Right.
And you kind of have to, just kind of self-soothe yourself that way, because there's a lot to get wrapped up in, but really coming back to the present moment.
The present moment.
Yeah.
Exactly.
Yeah.
Who were the biggest supporters while you were in nursing school? Because I think people don't talk about that aspect of nursing school enough, where we know it's hard. Yes. But the personal life we have outside of it, I think, is not talked about enough when, you have maybe family issues or spouse issues or, kids. So who was your biggest support system?
So my mom was living with me for the years that I was in nursing school.
Okay.
And she was a big supporter. She was just, very much a cheerleader, very much, whether it was like babysitting my dog while I went to class or going on a walk with me after we had dinner. It was just very, very supportive. And another thing I wanted to talk about is I do have a therapist that I continue with today. And I think therapy for me was a great outlet of all the stresses that I've had. Even in the OR now, it's controlled trauma, but it's still can be a trauma. There's a lot of different emotions that you deal with, a lot of heavy things. And so whether it was dealing with something that I want to unpack from my current job, or even going through school at Emory, talking to somebody that was a third party was very helpful for me. So I would definitely encourage anybody that's starting this process or at any time to kind of seek out and find somebody that you can speak with, because it was absolutely helpful for me.
I agree. I utilize Emory's, we had therapy for free. I don't know if you knew that or not, but I utilized that soon as I could.
Yes.
Because I'm, there's some stigma in it, especially in my culture sometimes, that, therapy or something wrong with you.
Yeah.
Nothing has to be wrong with you.
No.
You just want to make sure you have that unbiased third party to talk to.
Yeah.
And see if you're on the right track or get some advice or whatever, or just get bent.
Yeah.
So that was huge for me. I would say that. Using those resources that Emory did.
Absolutely.
Definitely. So would you do it all over again?
I saw that question and I thought about it, and yes, the answer is yes for me.
Okay.
Going through this whole roller coaster of everything, it was such a challenge, but coming out of it, I feel very full and I feel successful. And, at one point I was talking to one of my best friends, Tova, and it was just having a day. I was just like, I don't know if I want to do this, or what if I fail?
Is this recent?
Yeah, this was like in school.
Okay.
In school before I graduated. And I was just like, what if I don't want to do this? School's just so crazy. I don't even know if this is what I want to do. What if I fail and don't even get my license for some reason? And she's like, okay, like, let's go there. You want to go there? Worst case scenario, you don't get, you fail or you quit. Whatever you have retained so far will be helpful to you. And so it kind of made me think. I was on a plane recently to Orlando, and I was visiting a friend, and we took off and we were in the air, and all of a sudden they say, if there's any medical personnel on the plane, please report to the back immediately.
I got that question one time.
And I was like, okay,
So how was that? What did you do? So you were on the plane. So what did you do?
I was on the plane. I was just like, okay, I kind of just kicked into gear, and I was like, let me see if I can go help. I don't know what's happening, but let me go. It was back in March. It was like right after I started my job.
Oh, wow.
I was already an RN. Yeah. I'd only been working a month as a nurse, and I was like, you know what? Like, let's just go help. Let's just go see. And it ended up being a woman was overheated. She was a young woman, ended up being very overheated. We got her ice, we got her cooled down. She was fine at the end. And thankfully there was an emergency physician on board, which was better. Like, okay, we got the clearance from there, but just sat with her and, coming back to Tova, and I was like, look at what I did. And she goes, even if you don't consider continuing this for the rest of your life, or you want to make a career change, like, this is something that's valuable that you can use. That was really encouraging. It's still a roller coaster, and every day is still unpredictable. And I think it's still these questions, what am I doing? And is this what I want to continue to do? But I think that's just a reverberation of everything, that you have to continue to ask yourself those questions. But, leaving, even yesterday, I was leaving after a 12-hour shift, and it was a hard day. And I was like, you know what? I just feel full. I feel like this is valuable to me, and this is what I want to be doing right now. So that's what was important to me.
That is very good. I think I can say in my past career, I don't think I've had that feeling to the length that I have it now, because you're actually like really helping people. I think in my past I was helping a company, right? Where now I'm actually helping people, and whether I'm walking a blind man somewhere or I'm speaking to somebody who doesn't speak that language, but understanding, oh, you're cold, let me get you a blanket.
Yeah,
people don't understand like little things, right?
Right.
But yeah, back to the airplane. Like I meant to get like a little travel emergency kit. I think some nurses have those, because I got that question my first semester in nursing school. Yeah. And I put my head way down. It's like, I am not a medical professional.
I didn't have anything like with me, because we were going to go to it was a girls trip.
Why would
we
you
were going to go to the beach, and all this stuff. And my friend looked at me and she was like, okay, you gonna go? But I have a medical equipment for the festivals I go to. So you
still do those?
Yeah, I still do those.
Wow.
So I do have like a comprehensive, like, hot packs, cold packs, bandages.
That is a good skill.
I bring my just stuff if somebody gets like, there's medical tents there, but if somebody gets like a scratch or a blister, like I can help out. So I always like, for camping and things like that, I definitely have it. But on the plane, they had the oxygen. They barely had ice, but thankfully they had ice that we were able to cool her down.
Okay.
They had like a pulse ox to take her
Right.
oxygen. And then they had like a blood pressure cuff, but like the flight
It's like a
attendants,
cheap one.
yeah,
like, they're really
these,
cheap on the planes.
but all of these things were like very, like I think one thing didn't work, and then they had the oxygen, but she didn't want the mask on her, so we ended up like not even using all the technology that they had available.
Okay.
But it all worked out, so she was okay.
You jumped up and put the cape on real quick. It's like put the cape on.
I was like, let's just go see. I'll do something, you know.
That's good.
They needed help, and I wanted to try to help.
Of course.
Yeah.
So giving some advice or encouragement to people who may be thinking about switching careers,
yes,
whether it's nursing or otherwise, because I know for me, I imagine myself, you know, whenever I get old to an old age, not having any regrets. So for me, that's I'm going to do it. Works, it works, it doesn't.
Yeah.
So what are your words of encouragement to somebody who's on the fence about switching careers? Because, you know, we've worked for years in our previous careers. Right. So I'm like, it's not too late to switch.
Yes.
And so what would you say to that person?
Definitely. You know, I did a later in life career change. It's never too late to switch. If that's something that you want to continue to learn, I would encourage you to do that. You know, you don't have to make a decision right away. And I would encourage people to get their feet wet in what they want to do. Like when I was like, maybe I want to go into nursing, I started volunteering at Physicians Care Clinic, which is a free clinic in Decatur. Okay. And so I had volunteered maybe 1 or 2 hours a week, you know, every week. And it was just like checking patients in, kind of helping clean up the rooms, get people to the rooms.
You did the smart way. I didn't do any of that.
Okay, so when
that's how I think you should do it that way.
Yeah, get your feet, and it's volunteer work. You know, it's no harm, no foul. Twice a month, try it out. And when I was there, I met people that were professionally working in the medical field at Emory at different hospitals. And so if we had any downtime or I got to interact with them, I got to meet people that were in nursing school, and I could say, what do you think? Yeah. What do you think about that? What do you do in your field? What do you like about it? What do you not like about it? Okay. And another thing I did is just like do your research, you know. I put a Facebook post out and I was like, hey, anybody a nurse or that knows a nurse, can I talk to them? So I talked to a woman that I graduated high school with, who's a CRNA now. And she's been working in the medical field. You know, she went to school for that. So she did the whole travel nursing and she did everything. And then I talked to another woman, I think that was like just graduating nursing school. And then I talked to another woman who had been a nurse for like 30 years. So I talked to a bunch of people. And again, I had like maybe 10 questions, like an interview. What do you like? What do you not like? Why did you like to do it? And and everybody was like so excited to talk about it. They're like, yeah, give me a call. I didn't know a couple of these people. They were friends of friends. And they're like, yeah, let's talk next Tuesday. And like, you know, they're very excited. So that was just like doing your research, whether it's online, but I love the interaction, like networking, calling people up, going and volunteering and getting your feet wet. And then you're like, okay, do I really like this? Right. And then if you need to, I know some people need a set time to make a decision, like maybe setting a time in 4 months. It's going to be an F yes, or it's going to be a no. Like maybe you need a date, because people can go for years. I want to do this. I don't know, this and that. I don't know. But
that's a good point.
I didn't set it for me, but sometimes when I have to make a decision like that, I'm like, okay, you have all this time to do your research. And on this day, you're going to make a decision. So setting something like that might be helpful for people too. But yeah, getting your feet wet, I think, and volunteer work, I think is a big,
no, you brought up a good point. I didn't even think about that, because volunteer work, nobody's really going to turn down like free labor, right? Yeah. So it's volunteer work. I think that's a good way to do it. I think most industries will have in some form capacity something you can do for free.
Absolutely.
And learn about it. That's a good point. And you brought up earlier, I wanted to bring it up again. You even to this day say, you know, is this what I want to do?
Yeah.
But nursing, you can pivot so many ways. I'm still learning about ways. Oh, I could nurses do that. Nurses do that.
Yeah.
Oh. Have you felt that as well? Like learning about nurses, they can do so many other things besides what they're doing, right?
Absolutely.
That's one of the reasons why I chose nursing as well.
Yes.
You know, you can pivot real quick. You know, and you do festivals.
Yes.
And I think somebody said you could do a festival it's a big festival called the Burning Man, right?
Yeah, I've been to that a few times.
Really?
Yeah.
My friend just went last year.
Cool.
Yeah. Is it good?
Yeah, I love it.
They tried to get me to go. I was like, not yet. How was that anyway?
Amazing.
Really? Okay.
Yeah.
Nothing off the topic, but I was curious.
Yeah,
Was.
yeah.
Okay,
I do
right,
some local ones, and I've been to the big one a few times too.
Okay.
Yeah.
Okay. You also mentioned your friend said, what's the worst case scenario? So
Right.
going back to switching careers, I think that's a good way to look at, all right, what's the worst that can happen? And it reminded me, I don't know if you remember this. I'm not gonna say her name. It's like the first day in class or first week. And I think the director of the program said, you can graduate, but if you don't pass NCLEX, you'll have a pretty piece of paper.
Yeah.
That stuck with me. I was like, she's right.
Yeah.
I still have to pass NCLEX.
Yeah.
How did you feel about like the whole, now I got to take NCLEX?
So it's funny that, okay, we talk about festivals.
Right.
So it took me a while to get approved to take the NCLEX. Number one, it takes a while to get approved and before you can take the test. And it was the beginning of February. I had my job, but I had to pass the NCLEX by the end of February. Okay. And I was going to Love Burn, which is a Burning Man regional, right before, a couple weeks before I was going to start my job. So I had a week. Okay. I got approved and I had a week to find somewhere to take the NCLEX and then go to the festival because I was like, I don't want to take it after the festival. I'm just going to be exhausted. So it ended up that, my NCLEX experience was that I have an art car. It's a golf cart that I take to, is in Miami. So I couldn't find anywhere in Atlanta where there was an open test. I couldn't find anywhere in Macon. I couldn't find anywhere like
you had to do this within a week.
Within a week. And I found a place in Augusta. And so I ended up packing for this festival, all my camping stuff, all my art stuff, getting on the road. I rented an Airbnb in Augusta.
Okay.
So all my stuff, woke up, it was pouring rain.
Test day.
Okay. And test was like at noon. So it was like, okay, but I was trying to get there early, but then I couldn't take my golf cart. So I couldn't get an Uber. Thought I was going to be late in the Uber. Like I show up at the facility. It's raining so hard. I had my rain pants on and like my rain jacket on. And I was like, okay, let's do this. And I'm like a nervous peer. So I like halfway through, I'm like, I've got to go. And it's so nerve wracking. You got to go out. It's so official. They have to like lock you in and lock you out. It's just very nerve-wracking. And then it shut off at 85 questions.
How did you feel? Like, because the same happened to me. I was like, I didn't feel good enough that it would shut off and I passed. But I was like, I didn't bomb it though.
I didn't, when I'm taking, it's the same with nursing school. Sometimes I would take the test and I would be like, I'm bombing this, or I would do great. And other times I'd be like, I'm doing great. And then I would be like, not doing great. It's like, you really have no feel. So it cut off and I was like, well, I got to get to this festival. So I went back and like drove down to Miami after that.
Wow.
And so I stopped and then made it to Miami the next day. And then the following day I was setting up the camp. And I found out that I had passed and I was like, oh my gosh.
The next day you found out?
Yeah. And like I camp with this camp called Inspiration Oasis. It's a big Israeli camp. And we just like they were like, oh my gosh. You
gotta celebrate.
Celebrated. And it was and then I did the festival, had a week to recover, and then I started my job. So taking the NCLEX was like
you had to find a week. You had to go to Augusta to listen. I think I almost had to go to Tennessee for my test because it was like nothing was available. Then they opened them up further out, and I was like, all right, I'm gonna go here.
Yeah, I had to drive a couple hours.
Yeah, man.
But yeah, when it shut off at 85, I was like, it's really good or really bad, but let's just see what happens. It's
really good. I think I sat in the car. I think I recorded. I sat in the car. I said, I don't know.
Yeah.
I just don't know how I did. And the next morning, I got the results. While I was in my externship, they was like, because my nurses, I was there for like a year, so they were all like making fun of me when I was studying. They're like, you're going to pass. I'm like, you don't know that.
I know. Everybody's like, you're fine. Right. Even my Airbnb host was like, I was like, I'm here taking the NCLEX. They're like, we're nurses. We're working in, I think they were working in Atlanta, but they were giving me encouragement. You'll be fine. But you're like, but you don't know that.
Oh man. So I think the next morning, 8 a.m, I just had the website up just in case to check. And then when I pulled it up, it was already there.
Okay.
And I said, I can't even talk. They were like, oh, he passed. I'm
oh my gosh. Yeah. It's just like
people don't understand.
Accumulation of everything. Like
everything. Yes. It's I would to the question I asked you, I would definitely do it again. Like it's just the nursing, but it also shows you what you're made of as well.
Yes.
And how far you can tolerate certain things.
Yeah.
Mentally, because I think we had a couple people who switched careers in our class. Maybe 2 more. So are we switching again, or are you staying with nursing?
For right now, again, I'm
Right
going to
now.
come back to the present moment. Because like I'm still in the residency program. I'm just starting to work on my own in the OR. It's
Okay.
just been a few weeks since I'm working by myself, and it's like a whole hurdle of like, what am I doing? Okay, I think I understand. And then again, working by myself, what am I doing? Is this crazy? Okay, I'm going to get it. I've got a lot of resources that I can use. So for now, like I really can't say because
That's
for
fair.
right now, I'm still just like getting my foundation and getting everything. So at this point, I'm staying where I am and learning everything that I can learn. And I think, I've heard that it takes at least a couple years to really feel comfortable.
I heard that. Yep.
And feel confident. So
Right.
that's my next step is getting to the, I'm 8 months in. I'm like, let me get to 2 years and see how that feels.
Okay.
And then and at the 2 years, you can sit for like the CNOR too.
Okay.
So
That's
that
right.
would be a next step for me.
Okay.
Yeah.
Good. That was the next question. Next
Yeah.
steps. Okay. CNOR.
Mm-hmm.
So since we both work in OR,
Yes.
I have a couple of OR questions
Okay.
for you.
Okay.
So what do you find the hardest part of working in the OR is?
I think like logistics are logistics and equipment is equipment, but personalities.
I was going to say
Yeah.
personalities. I swear, I was going to say the personalities you have to navigate.
Yes.
So what has your experience been?
Well, that was one thing that translated from my last job, being an executive assistant. I dealt with the C-suite level people, and it's a little harder now because I work with different surgeons every day. But when I was an executive assistant, I was like, okay, they like their hand held on this thing, or she likes everything on her desk at the very front of the day, and then she'll take it from there. You kind of figured out like what everybody likes. And
That's
now,
how the OR is.
going in, you're like, okay, well, how do they like everything? What do they need? There's not one way to do a surgery necessarily.
Right.
And so whether it's like the dressings that they want or the timing or
the meds.
everything could be different, or like even the music, like you have to be a DJ.
People don't understand. As an OR nurse, for people who don't know, let me explain this, right? We deal with medications, we deal with dressings, we deal with personalities. Oh, yes, we're DJs as well. Coordination, logistics. We do a lot of things.
Yeah.
Am I lying?
Yeah. No.
No, I'm not. We do a lot of things.
My last 12-hour shift, I think I walked like 8 miles. You're running around. You're getting everything for everybody.
I started to look at that as well. Like, how many steps have I taken? Like, oh, my God.
So it's really working within the team and keeping everybody happy and kind of and to do that is to understand next steps, like, okay, when are we closing? Okay, well, you need to be the one to be like, okay, well, what dressings do you want? If you don't know, you have to. And some people are so great. They're like, I want this, I want that, I want that.
Love
and other
those
people,
type of surgeons.
yes,
oh
I'm like,
God.
just tell me, we'll get it done. And other people, you kind of have to draw it out of them, or you're like,
or they talk
I
really
want this,
low.
Or I want,
I'm like,
so
say it again.
So just like polite, if you're dealing, sometimes you don't like people, but you can work with people.
Of course.
The
patient is the goal right here.
Yeah.
So
and that's what I would say is just the personalities and being confident and like being able to politely and confidently get what you need for yourself as well as the rest of the team.
Do you see any people in your periodic program that are starting like now or a couple months ago, and do you see yourself in them when they started?
Yes,
right
absolutely.
So I'm like, was I like that? Because they're like really timid. I'm like, you'll be okay. They're like, I don't know.
That's what everybody kept saying to me. They're like, you'll be. I'm like, I don't know if I can do this. I don't know if I can do this. Like, how do you do this? So it was like lightning. People just move so fast, and you're like, how do you remember to do this?
How do you remember what things are? And
yeah,
oh my God.
And people were always, there was no like set agenda or like formula. They're like, you'll just figure it out. And I'm like, I don't understand. I'm such like a organized person. I'm like, step 1, step 2, step 3, what do we need? Lists and everything. And for somebody to just be like, you'll figure it out. I'm like, will I? Like, I don't, it still doesn't compute in my head, but every day that I go in, you just figure it out.
You really do. And that's some people look at the, I think they have like the surgeries for the next couple of days. I don't want to know until I get there. Like, I walk in, I don't know what I'm going to do. I don't know what
Yeah.
I'm gonna, I like that feeling.
You do?
I do.
Okay.
Because some people are like, oh, I got this tomorrow. I don't want to know what I got tomorrow.
Okay.
Because then I want to go home and dwell on it.
Yeah.
Like,
I want to know what I have tomorrow.
you do?
I'm the
Like, oh
opposite.
my
I'm like,
God.
let me think about it a little bit. I'm like, let me
Now,
get
it
my
is smart.
game
I will say that
plan.
is smart to do it that way because you get a game plan. You know the
Yeah.
surgeons you're working
Yeah.
with. Me, all right, just put me in the game.
Okay.
When it's game time.
Okay.
I'll
Okay,
figure
let's
it
do
out.
this.
Let's do this. So that's how I am. But the other thing I want to touch on before we wrap up is I think, and it goes the other way around, but the success of the nurse heavily depends on the type of tech you have.
Yes.
And if they are good tech or bad tech and so I've noticed that, you know, being on my own as well, you have some amazing techs that will do things that is not really in their scope,
Yeah.
but they'll help you out and makes you want to help them out as well.
Right.
Then you have other techs that, you know, will gown up, sterilize, and sit in the corner.
Yeah.
And then you have to do all the things,
Yeah.
which, you know, you just have to, like I said, navigate that. What's your experience with that?
You know, the same thing coming back to the personalities. Everybody's going to have good days and everybody's going to have bad days. You know, it's difficult for me to come in sometimes with the tech because I'm inexperienced and I'm like, well, what do we need to do? I might need to rely on them or vice versa. And coming back to just different personalities of what questions do you need to ask each other in order to work together the best?
Right.
Coming back to the basic foundation of what's important, you know, counts, patient positioning, safety, communication, and working together. And I think like that's the only way that you can approach different things. But I think you can get a full spectrum of personalities, whether it's the doctor, whether it's the tech, how into it they are, what their day is like. So it's really just a conglomeration of teamwork. And that's what's important when you go into the
Especially
OR.
in the OR. Do you guys have residents in there?
We don't have residents.
I'm only saying it because obviously, you know, the hospital I'm talking about is we're a teaching hospital.
Yes.
So we'll be in a room and it's like 15 people in the room. Like,
Yeah.
oh my God. And we got to get the names. And so
Yeah.
that's something if you're in a teaching hospital or a hospital like that, you also have to deal with those residents who may think they know everything.
Yeah.
You know, it's like I had somebody who they're rushing everything. You know, the case just ended and like I walk out, ready for the next one? We didn't even do turnover yet.
Yeah.
I'm like, I need to relax. And I remember one time they were rushing. The patient was transferred to the OR bed and he was trying to take the bed away. The patient IV was still hooked up on the bed.
Yeah.
And I said, I had to like yell, hey.
Yeah.
He was like, oh, I'm sorry. Stop rushing.
Yeah.
That's the point.
Yeah.
So like you say, you have to navigate those personalities. And for somebody that rushes, that makes me go at an even more, not slower pace, but a calmer pace.
Yeah.
To let them know this is not the room we're going to do that in.
Yeah.
You know?
Yeah.
So yeah. Any last words? Like I said, I think the switching of careers for me has been good. I don't know where I'm going to go, but I think you have a good plan.
Yeah.
And I think your words of encouragement were good as well. So just really want to get your perspective on switching careers.
Yeah, absolutely. You know, it's a full journey of what you want to get into. And anybody that's considering switching careers, you know, like we touched on, get out there, get your feet wet. You can do it. You know, it's your confidence is going to be tested along this trajectory of this journey. So getting your support system, like we talked about, getting, you know, if counseling's it, friends and family, getting what you need to lay your base foundation so you can build up from there. And then just, you know, even me, like in my office where I worked, I would put affirmations. Like that helped me too, like writing down affirmations of like, you're here because you want to be, or you're here because you made it happen and you can do this and you're powerful. And even little things like that, just coming back to your why, establishing your why, coming back to that and knowing you can do it. And it might not be easy. One analogy that I like to talk about, is standing on the edge of a diving board.
Okay.
You know, like that's kind of what I felt like when whatever big project I've gotten into that's required blood, sweat, and tears for me. You're at the top of this diving board, you're scared, you've climbed all the way up, you're shaking, you know, the wind's blowing, you're looking down and the pool's so deep and how am I going to do it? And then finally, when you take that leap, when you land in the pool, like normally I would land and be like, wow, that was so fun. Like I want to do it again. So like anybody that making that decision is standing on the edge of that diving board, and it's harder to stand on that diving board than it is actually to jump off and launch yourself.
I never heard that before.
Yeah. So I would, you know, if you're feeling pulled into some direction like that, explore it. and just know that you can do it.
Good stuff.
Yeah.
Good stuff. I appreciate
Absolutely.
it. We're breathing testaments to that.
Yes.
We can do that. So again, Emmy, thank you so much for your time.
Thank you so much for having me. I really enjoyed
it. Of course. If you happen to switch again, I will have you again. Again. But I hope you don't.
Okay.
But again, until next time, it's Ivy League, Jazz, Emmy. Later.
Thanks so much.